Hi there, this is Dr. Desai from RestorePDX and soon to be elected as president of the largest nonprofit organization for regenerative medicine in the musculoskeletal regenerative medicine space. And this has become my passion over the last 10 years. I was lucky to be introduced to regenerative medicine a long time ago when I was a skeptic, right? So you hear about that you can take PRP or you can take someone's blood product and inject it into tissue and actually heal something. And I'm a MD, an allopath, very black and white doctor. I'm a musculoskeletal radiologist, right? We read in black and white. And so for me, it sounded too good to be true. And so I was very skeptical and there was a lot of trepidation, but the standard of care wasn't really satisfying to me, treating patients with steroids or narcotics or sending them to sometimes unnecessary surgeries, or sometimes the patients weren't even surgical candidates. So I started doing this about 10 years ago. And patients were coming back to me and saying, "Doc, I feel fantastic." But I was treating a torn rotator cuff, or I was treating some torn tissue that we had diagnosed on MRI or ultrasound. And we put in this PRP, which we vetted and felt like, it's their own blood product, it's relatively safe. And when patients came back, in the beginning, I thought they were just trying to be nice or make me feel good and say, "Oh, Doc, I feel really good." So I said, "Well, that tissue was torn. If you feel good, we should see some difference." So we put them on the MRI scanner and it was fixed. And so now about 4,000 patients and 10 years later, I'm an evangelist. The medicine is truly transformational, and I think it's the future. What really worries me though is that this medicine, because it is so, is relatively safe, you can treat almost with impunity at times. And it's an unregulated field because it's so nascent, it's so new, that there are a lot of bad actors getting into the field that are uneducated, maybe at best, and at worst are duplicitous and are trying to take advantage of patients. And it's kind of a bait and switch that, hey, these studies show that stem cells work and it's the best thing ever and it's healing tissue and it's going to fix everything, right? And so you go to certain providers and it's doctors, it's chiropractors, it's nurse practitioners, it's naturopaths. There are good and bad physicians in every single field. And so I don't think it needs to be labeled as one particular field. But why I'm making this announcement is that we need to be careful and thoughtful for our patients, because people are being taken advantage of. And what really worries me is there are patients that are being taken advantage of, there are systems that are being taken advantage of financially, and we're putting people at risk. And we're also putting this medicine at risk. This has been transformational for myself. I've had numerous treatments that have helped myself, my family, my patients, and it's been an amazing ride to see how powerful this medicine is. But it is at risk right now, and it's because folks are taking advantage of this, and everybody's being lumped in the same system as kind of duplicitous and doing this for the money and not for actually helping patients. So some of the things that we need to do as advocates for this type of medicine are educate the patients, and educate the physicians that are taking care of these patients as to the right thing to do. And one of the first things that I can express to you, I have a 3-legged stool of regenerative medicine. And if you apply this to all the things, I think you're going to try to get, and ask those questions of your providers and whoever's trying to sell you or advocate for this type of medicine. Ask 3 things of yourself. So this 3-legged stool, if you sit on a 3-legged stool, it'll be stable. If one of those legs is not there, you're going to fall down. And so that's proper diagnosis. Is the clinician or is the provider getting the right diagnosis? Are they taking the time to listen to you? Right? Are they taking the time to evaluate you with imaging, with physical examination, with a neurologic examination, with x-rays, with MRIs, with the right tools, and getting a real diagnosis, not just shoulder pain? That's a symptom. That's not a diagnosis. Do you have a rotator cuff tear? Do you have arthritis? And number 2 is the second leg of the stool is proper biologics or precision biologics. So the first was precision diagnosis. The second is precision biologics or therapy. What are they actually using? Are they using your cells? Are they using stem cells for your bone marrow? Are they using stem cells for fat? Are they using amniotic growth factors? Are they using amniotic cells? Ask them the questions and ask them, why are they using that? And what is the data behind it? And so really there are a lot of different choices, and the field is emerging and it's changing. So I'm not here to tell you which one's the best and which one's not, but you have to ask the questions of why are you using that? And do you have clinical information or data? There should be a reason why that clinician is using that, not just because a salesperson told them that this was the best thing that they had, right? They really need to understand the medicine. So that's precision biologics. The last leg of this stool is precision delivery. Because if you get the right diagnosis and you have the right product, if you can put it in the right place, you have a very high success rate, and you're going to have good success, or a good chance of success. So the precision delivery is, putting in the right place with image guidance. So if you're treating a ligament or a tendon, it's not guesswork pushing on it and injecting it. It's using ultrasound guidance. It's using X-ray guidance. It's using CT guidance if appropriate. And so all of those things need to be together. And so if you use those three basic questions, what's my diagnosis? What are you using? What are you putting in there? And how are you getting it delivered? If the physician, clinician, whoever's treating you can give you good, solid answers and you feel comfortable with that, then I think you have a very good chance of success. So I hope this helps you kind of navigate this field. If you have any questions, please feel free to reach out to our practice, to reach out to the Interventional Orthopedic Foundation, and the website is below. And we hopefully that we can, move this medicine forward in the proper way.